Hello everyone, my name is Yi-Chun Hsieh, and today I'm going to talk about the obsessive-compulsive disorder, or OCD, and how virtual reality is changing the way it's treated. OCD is a complicated disorder marked by the intrusive thoughts and repetitive activities. In this session, we will look at the fundamental characteristics of OCD, the problems that those seeking treatment experience, and the transforming power of virtual reality in giving a new route of recovery. So, what is OCD? The obsessive-compulsive disorder, OCD, is a mental disorder that affects people of all ages with a prevalence of approximately 2% to 3% in the world. And it has two main components, obsession and compulsion. The obsession and are unwanted and intrusive thoughts, images, or urges that repetitively enter a person's mind. These thoughts are distressing and often go against a person's value or beliefs. On the other hand, the compulsion are repetitive behavior or mental behavior performed in response to obsession. They are driven by a strong urge to reduce anxiety or prevent a fear outcome. A common obsession for people with OCD is fear of sickness or contamination. This may lead to excessive hand washing or avoidance of certain places or objects. The OCD can have a significant impact on a person's daily life and relationship, as persistent obsessions and the need to perform compulsive behaviors can be time-consuming and distressing. However, it is important to remember that OCD is treatable disorder, and seeking professional help can make a big difference in managing symptoms and improving quality of life. So what can we do? It's important to understand that it is a chronic condition that requires proper therapy and treatment. The early intervention is important, and awareness plays a vital role in prevention. We can help individuals and people around us understand the signs and symptoms of OCD and encourage them to seek professional help by raising awareness about it. Furthermore, having understanding, empathy, and support for persons living with OCD is important in eliminating the disorder's stigma. By creating a supportive environment, we can empower individuals to openly discuss their experience and seek needed help. Then we can make a difference in the lives of people with OCD. So why people suffer from this disorder? According to research, a combination of genetic, environmental, and neurological factors contribute to the development of OCD. OCD has a genetic component as it runs in family, implying that specific genes and variation may enhance the likelihood of getting this disorder. Neuroimaging studies have identified difference in brain structure and functioning in people with OCD, particularly in areas of brains involved in decision-making, anxiety regulation. Individuals' OCD symptoms can be triggered by environmental factors such as stressful life events or trauma. Furthermore, a certain mental factor, such as perfectionism, may have a role in the emergence and the maintenance of OCD symptoms. So, speak to the common treatment. One of the common treatment for OCD is the cognitive behavioral therapy, the CBT, which helps people with OCD change their thoughts, behavior, and emotions simultaneously. A specific type of CBT called exposure and response prevention, the ERP on the right-hand side, is often used for OCD. This involves gradually facing situations or things that make a person anxious and stop them from doing their usual compulsive behavior. This helps them learn that their anxiety goes down naturally over time without needing to do the compulsions. The ERP can also used to treat other anxiety disorders like the social anxiety and the panic disorder. Both CBT and ERP can bring significant relief to people with OCD and improve their lives. So the exposure therapy in the virtual environment, the VR, provides a unique approach to offering safe exposure for OCD therapy by simulating anxiety-induced situations. These innovation techniques use immersive technology to create virtual environments that trigger anxiety in individuals with OCD. The key advantage is that these environments are controlled and safe, allowing the therapist to guide patients through their fear without any real-world consequences. In VR-based exposure therapy, patients can confront obsessions and compulsions in a realistic, simulated world. The therapy aims to desensitize individuals and reduce their phobic response by gradually exposing them to anxiety trigger. Through repeated exposure, patients can learn to face their fear and develop coping strategies to managing their OCD symptoms effectively. The virtual environment used in VR therapy can be customized to copy real-life situations that trigger anxiety in individuals, such as contamination fear or checking compulsion. These realistic simulations enable patients to face their fears in a controllable way. Therefore, using VR as therapy offers a promising avenue for OCD therapy, providing a safe and controlled space for individuals to confront their fears and also reduce the phobia. So the result of the research comparing virtual reality exposure therapy to in vivo exposure response prevention. So it's like the vivo exposure is like in the real life, and it shows the equivalence level of anxiety in both exposure therapy. So this finding shows that the VR-based therapy can effectively induce anxiety level comparable to real-life exposure scenarios. Moreover, VR-based exposure therapy has demonstrated additional benefits, such as increased engagement and therapeutic relationship maintenance. The patients have reported higher level of interest and motivating during the VR session, which may increase the treatment success. Furthermore, the VR exposure therapy has been shown to trigger emotional reaction in those with contamination-based OCD. This response to emotions helps the therapeutic process by assisting patients in confronting their concern and engaging more effectively with the treatment. The positive result of VR-based exposure therapy in treatment of contamination-based OCD demonstrate VR as a genius and valuable exposure therapy technique. The findings support the usefulness and promise of virtual reality in the treatment of OCD, especially in the context of exposure therapy. So as a result, the VR exposure therapy can be used to be a reliable and effective tool for providing exposure therapy in the treatment of OCD. So, in conclusion, The OCD is a complex mental condition that significantly impacts people's life, but it is treatable. Early intervention, awareness, and support are essential in controlling OCD symptoms and minimize the disorder's stigma. OCD is caused by a genetic, environmental, and neurological factor, and comprehensive treatment is needed. So people will use the scientist and the hospital will use the ERP, the exposure and response prevention, which has proven effective in treating OCD. So the scientists use VR, this innovative approach, which provides a realistic, changeable, anxiety-induced experience. And this can enable individuals to face their fears in a controllable and safe environment. By immersing patients in a virtual environment that is stimulates their anxious situation. The VR-based exposure therapy has shown good results in improving OCD outcomes. Also, the finding discussed today contributes to a growing number of research supporting the use of VR in OCD treatment. This finding highlights the potential of virtual reality as a valuable tool for the therapist and the patients, providing more accessible and engaging treatment options. So as a VR technology continue to develop and improve, we can expect further advances in the field of OCD treatment. The success of VR-based exposure therapy paves the way for future research and widespread implementation of this innovation treatment approach. By adopting this promising treatment approach, we can provide OCD patients with more effective and targeted treatment that can significantly improve their quality of life. And these are the reference. Yeah, thank you.